Hi, I'm Beth Wrobel, and I'm CEO of HealthLink, and HealthLink is a federally qualified health center in northern Indiana. We have 5 sites, and they're all different. We have some that are more urban and more rural, and in some we are the medical provider, and some we're medical, behavioral health, and dental provider. We employ about 150 employees, and last year we served about 17,000 unduplicated patients with about 70,000 visits. Today I'm going to talk to you a little bit about what has become one of my personal passions and such a needed service at our clinics, and that is integration of behavioral health into primary care. So much of our physical health is affected by our behaviors. Why can't Beth lose weight? Well, maybe because she eats too much and doesn't exercise enough. That's a behavioral change. People who smoke. Why do people smoke? Well, they have a behavior. It can also be people who are chronically mentally ill with bipolar disease or schizophrenia. So much of what we do is affected. And so here at HealthLink, over 10 years ago, we started on what I call the journey to integrated care. And we're not there yet. We're on that journey. And so we saw that our community mental health centers were overburdened with a lot of patients. Our providers had nowhere to send their patients. And so we started a partnership here in Valparaiso first with one of our community mental health centers, Porter Stark Services. And we tried many different things. We tried having a case manager here that would do an intake. Well, there's always a stigma of going to the community mental health center. You know, I'm not going to go to the loony bin. I don't need that. So that really didn't work. We brought in one of their psychiatrists, and lo and behold, they had a wait list of months at the community mental health center. Well, we thought, well, we'll bring them over here. And within about 2 months, we had a wait list of 6 months. So we started to realize there had to be a better way. And so we partnered with our community mental health center and found out of Tennessee there is a FQHC that's both the FQHC and a community mental health center called Cherokee. And we went down there, and they used a model of what they call brief intervention. So instead of finding someone who was depressed and having to send them to the community mental health center, we actually have some of their licensed clinical social workers right here on staff. And so when a provider sees someone who's depressed, needs to lose weight, needs to stop smoking, is bipolar, they can just do the physical part and then say, as our medical director likes to call it, I got a guy for you. And that guy is, we call him Captain Kirk. He's an LCSW from Porter Stark. Calls him right in, and they do a warm handoff where they introduce them. And in most cases, our patients don't even know that they've met with someone from the community mental health center. That LCSW, which we call a behavioralist, will work with these patients, 3 to 5 times. If they need more help, they have the psychiatrist there once a week, and they can see some of the patients. The amazing thing is we started to weed out those who really didn't see the psychiatrist. So remember that 6-week wait? Well, we used to have the psychiatrist 20 hours a week. Well, now we've been able, through changing our processes and really working with the LCSW, who can do a lot of different therapy, we've been able to cut back the psychiatrist to 4 hours a week and not have a waiting period for him. So that's been an amazing thing, and we're getting more people to get those behavioral health services that they really need. Since that start with Porter Stark at one location, we've been able to partner with 2 other community mental health centers at our other locations, and that has been amazing progress. And our providers are happier, our patients are getting the services they need, and it really has started to help some of our outcomes, whether it can be all those things that I talked about, also diabetes. The behavioral health consultant works with those patients who are diabetic, first of all, to accept their diabetes, but also work on self-management goals. The other thing that I really am excited about that we do here at HealthLink is that we're the medical provider at the Community Mental Health Center. Chronically mentally ill patients die 25 years before their age of peers. And we heard that about 4 years ago, and we were pretty disgusted about that and said, not in Valparaiso. So again, we partner with the Community Mental Health Center, and every day for 4 hours a day, we have a clinic inside, a full clinic inside of their Community Mental Health Center, where we see either their day treatment, which are mostly chronically mentally ill, or people in their inpatient, people who are in their methadone clinic. And we are the provider, medical provider, but one step more, unless they're taking their clothes off, they also see their case managers with them. So if the provider says, you need to go get a lab result, or you need to go exercise 4 hours a week, that case manager from the Community Mental Health Center works with them on that. And one story I'd like to share is, and I can share this because he actually did a write-up, worked with our local United Way, and did part of his story here. And his name is Wayne. And Wayne has got some severe mental illnesses. He's the cart pusher at our local Target, and I used to see him all the time, big guy, and he just didn't look happy. We actually got him into the services, started to take care of, he had very bad heart disease. We started to work on that. And then about 2 months ago, we were coming in for a meeting, and we meet a lot as a senior leadership team to make this all happen. And we were in there, and our nurse practitioner over there saw Wayne, and he was limping. And he said to Wayne, see me in clinic today. He went there, came into clinic, rolled up his leg, and he had cut his foot over the weekend and had cellulitis all the way up to his knee. We immediately had to transport him over to the hospital. They started IVs on him, and he was in the hospital for 2 days. Now, the amazing thing is, he was probably about 1 day away from losing his foot. If he lost his foot, he would not be able to work. He would not be the smiling person that we had gotten him to. And what effect, not only in his life, but really into the old healthcare system. He would have been someone who was disabled and wouldn't have been able to work. So by treating the whole person here, like we like to do at HealthLink, we like to also say the neck, the last time we checked, the neck is in this body, we're able to integrate all that together, and it really results in very good clinical outcomes. So I strongly recommend every health center should be doing this integration, because it really does treat the whole body.